Good afternoon to everybody, and welcome to this masterclass Analog to Digital Switchover from the Digital Care Hub. We'll just give it a little minute for people to join, and then we'll start the session. Just give it one more minute for other people to join. For those of you that have joined, warm welcome. We are recording the session. That will be shared with you, and the slides are going to be shared with you as well. Okay, I think we'll start. So again, welcome everybody. So this afternoon, Digital Care Hub are delivering this masterclass Analog to Digital Switchover. The next slide. So as I said, the webinar is being recorded. You are all on mute and we can't actually see you. So please, if you've got any questions, put them in the Q&A function rather than the chat. The recording will also be available and you can access it from Digital Care Hub, but it will be sent to all attendees and those that have signed up for the workshop. Thank you. So I'm Beverly Footer. I'm Digital Transformation Lead at the National Care Forum Room and a member of the Digital Care Hub. I'm delighted to be hosting this afternoon's session. We've got some great expert speakers this afternoon that are going to deliver different aspects of the analog to digital switchover, which is fantastic. So we've got Emily from Department of Health and Social Care, Connor's with us from Partners in Care and Health and the LGA, and Richard Keys from 2IC Care. So the presentations will take about an hour. You will have an opportunity, like I say, use the Q&A to ask questions of our expert speakers while we have them. And then we'll have an opportunity at the end to explore those questions. And we aim to finish by 3:30. So for those of you that might not know who Digital Care Hub are, it's a partnership run by the Care Provider Alliance. And what's fantastic about the Digital Care Hub, it represents all aspects of the adult social care sector. Membership is covering over almost 10,000 organisations, employing over 600,000 staff and supporting an estimated 1 million people. What's critical about Digital Care Hub and what's fantastic about it is run by social care providers for social care providers. Working in partnership with a range of providers, representative bodies, statutory bodies, Digital Care Hub supports the digital journey of all adult social care providers in England. And we're delighted Digital Care Hub is funded by the Department of Health and Social Care and NHS England. And we thank them today for us to be able to deliver this webinar. Okay, so I'm going to hand over to our first expert speaker, and that's Emily Smith. And Emily is going to talk to us about the very recently launched Telecare National Action Plan. So over to you, Emily.
Hi all, thank you so much for having me. So yeah, my name's Emily and I'm the Policy Manager at the Department for Health and Social Care. And I work on the digital switchover and specifically how it affects telecare. So today I'd like to discuss the Telecare National Action Plan with you and the proposed next steps. So the TNAP is a joint DHSC and DSIT National Action Plan that has been developed with input from stakeholders, including communication providers, the telecare sector, charities and local authorities. The TNAP sets out government's expectations of stakeholders and the agreed actions that need to take place to safeguard telecare users during the digital switchover. We are aware that sadly there have been a number of serious incidents concerning telecare users, but DHSC places the utmost importance on safety, and we are taking the appropriate action to mitigate risk to vulnerable users and monitor industry as the migration progresses by setting out the expected actions in the TNAP. This plan outlines the previous work to date on this issue, including steps that have been taken to encourage data sharing and commitments by communication providers through public charters. And feedback so far has been really, really helpful. So we just wanted to use this session to give you some more information, but also get your valuable insights to be able to shape the next iteration of the TNAP. I'll be asking some questions for discussion throughout the meeting, so please feel free to pop your answers in the chat box as we go along, and I can then take them away to answer. Next slide, please. So the TNAP was published on the 11th of February, and thank you to those who have engaged in the TNAP in detail. The key actions that we think will be most relevant to you as social care providers are as follows on the screen. But just to pull out a couple, so we've got Action 1.1, for example, which focuses on the sharing of data to ensure that Telecare users are correctly identified so that the safeguards can be put into place during the digital switchover. Now, given the potential for serious risks, this action supports our objective that no Telecare user is left without a functioning Telecare device. Communication providers recognise Telecare users must be provided with additional support during the process of their phone lines being switched. However, they can struggle to identify Telecare users within their customer base. Data sharing is therefore a vital part of our collective and continued efforts to safeguard Telecare users. Then we have Action 3.1 as another example. So Telecare users and their support networks need to be aware of the digital switchover. This includes what the digital switchover is, why it is happening, and the importance of the safety of Telecare users during the process. So we urge you to raise awareness of the digital switchover through your networks to ensure that Telecare users are protected. Now, we are aware that care providers have some unique challenges relative to the digital switchover. So it would also be good to hear your initial thoughts or concerns on the above actions now, and then this will be able to help with our policy thinking going forward. So if you could just put your initial thoughts or concerns in the chat box, and then I could come back to it at the end of the presentation. Thank you. So next slide, please. So moving on to next steps, government will continue to monitor the risks, particularly in light of non-voluntary migration starting again. Given the complexity of this issue, it is possible that additional necessary actions might be identified. As such, we will review progress against this action plan every 6 months, monitoring implementation and effectiveness. And all updates and new actions will be documented and engaged on with stakeholders to ensure transparency. So our next set of priorities are as follows. We'll establish a date for Analogue phase out. We'll monitor progress, risks, and tackle emerging issues, including 2G switch off and scams. We will also explore the use of national standards for Telecare. And finally, we will also shape a communication provider-led national communications campaign. We are particularly keen to understand how social care providers could be brought into this work, as we really value your feedback to be able to shape the work going forward. So it'd be great if you guys could put your thoughts in the chat box now. And again, I can answer any questions at the end. Next slide, please. So moving on to my next slide, government continues to encourage the use of technology-enabled care, also known as tech, and the future-proofing of Telecare. Recent social care announcements on the Baroness Casey review and short-term reform to social care included the setting of new national standards and trusted guidance on the best technology in care. This is so that people receiving care, their families, and care providers can confidently buy what works and get the safest, most effective tech into their homes or services. And this will include standards for Telecare specifically. So in line with government focus on promoting technology-enabled care, the TNAP encourages Telecare service providers to make sure that they are future-proofing the replacement of Telecare devices by considering new tech solutions and whether they would better suit their needs. There are also impacts on the wider social care system, given the PSTN impacts, and we will be working with the Digital Care Hub to increase their understanding of the switchover on social care settings amongst providers. Now, there's already some digital switchover related guidance on the Digital Care Hub, but it would be good to know if you guys have engaged with that at all, or how or if we could better signpost to it. So again, yeah, just pop your thoughts in the chat box and that would be great. And then final question, it would just be great to know if you guys think that there's more that we could do to support social care providers to be able to realise the benefits from tech. But yeah, I'm happy to pop the questions in at the end. So yeah, thank you very much.
That's great. Thank you very much, Emily. Just checking we don't have any questions at the moment, but I would encourage people that are joined us to think of those questions and put those in. So that's brilliant. Thank you very much. Right, now I'm very happy and delighted to hand over to Connor James from Partners in Care and Health and the LGA, who's going to give us a local authority perspective on the analog to digital switchover. Over to you, Connor.
Yep. Hi, everyone. Yeah, and a big thank you for having me here today. Great to be here. So I work as an advisor within Partners in Care and Health over at the LGA and specifically look at kind of digital transformation initiatives. And as said, I'm here today to look at the digital switchover specifically from, I suppose, a local authority perspective and what that experience has been like. Next slide, please. So yeah, just in terms of that introductory text, so the LGA and ADAS are Partners in Care and Health working together with well-respected organisations. Partners in Care and Health help councils to improve the way they deliver adult social care and public health services and help government understand the challenges faced by the sector. And the programme is a trusted network for developing and sharing best practice, developing tools and techniques, providing support and building connections, and it's funded by the Department for Health and Social Care and offered to councils without charge. So in terms of what I'm going to talk about today, I wanted to briefly touch, I suppose, on a bit of the context around the switchover, and apologies to anyone if this is all old news. So I'll be looking at kind of why we're here, so why now, what the digital switchover actually is, what it's looked like for local authorities, the challenges around the switchover for local authorities, as there have been some, a case study around the kind of Stockport Council and the work they did collaborating with VMO2 and the TSA. And then hopefully what might be helpful is a few process maps around what an organisation might seek to do in response to the switchover and some final resources as well. So an introduction as to why we're here now. So the Public Switch Telephone Network, or the PSTN, which is your analog lines, are failing. So they're reaching their end of life. And there's this deterioration piece, but there's also the fact that there's a lack of the production of the equipment needed to repair these lines now, and also a loss of expertise, as many of the engineers with that expertise are retiring. So since 2020, the fault rate on PSTN was 50% higher than fibre to the premises, and in 2023, the number of PSTN incidents increased by 20%. So we have these two factors in which, comparatively speaking, PSTN has a much higher failure rate than kind of broadband, and also, sorry, I was on this, my apologies. And also we have this kind of increase of incidents as well. So in response to this, communication providers are looking to retire analog lines by January 2027. So what is the digital switchover? So as just mentioned, between now and 2027, communication providers will be moving their customers from PSTN to upgraded fibre services. And this could be fibre to the premises, or it could be fibre to the cabinet. And for many of us, it's not something that we'll necessarily notice. I'm sure some on the call probably or maybe don't necessarily use their kind of analog landline and have used broadband for a while. But for some, the impact will be quite significant. The upgrade is being delivered by industry using a phased approach, and I think the key point here is that different providers have different timelines, and that's where some of the complexity comes into this. We look at TalkTalk or Sky, for example, and their messaging would be that they aren't necessarily migrating customers, whilst we then speak to BT, and their approach would be that they very much are, and they might be taking a regional approach to this. So part of the challenge is understanding where your given provider is in terms of that kind of migration journey. The main point being that any devices or systems reliant on traditional analog lines will not function, or will at least be kind of severely impacted, or potentially be severely impacted by the switch over. And there are kind of numerous use cases for the PSTN, these including alarm systems, medical devices, monitoring equipment, traffic lights, kind of all sorts really. Obviously, the main one today that I'll focus on is Telecare, but just to mention that there are kind of broader impacts. So organizations must or should complete an audit of equipment to understand the kind of scale of the impact of the switchover. So yes, looking specifically at local authorities. So as you might imagine, obviously councils are responsible for a huge range of analog reliant devices. And And as part of this, they've obviously had to complete an audit to understand the scale of the impact of the switchover for each local authority. And yeah, the migration of telecare from analog to digital has presented a real challenge. This being the result of a number of different factors, the identification of telecare users, the fragmentation of communication providers, so that's industry, finding a digitally capable telecare solution, funding, etc. So quite a few challenges there, and I'll discuss them in the next slide. But as part of this, councils are signing data sharing agreements and sharing data to identify vulnerable telecare users, and they're also upgrading their telecare to digitally capable solutions. So in terms of challenges for local authorities, so I think number one would be the identification of telecare users. And that's not to say that local authorities don't know who their telecare users are, but the case is that obviously communication providers are migrating residents at different timelines. And what that means is that they might not be aware of who the telecare users are. So for example, BT might look to switch from analog to digital in a specific area, not knowing that there are telecare users in that area, switch them over, their telecare solution, which is kind of analog reliant, no longer functions. The alarm fails in the event of a kind of emergency, and there's potentially serious kind of ramifications. So to combat that, what local authorities have been doing, and as mentioned by Emily, is this data sharing. So signing data sharing agreements with communication providers to outline who their vulnerable users are. So what that will look like is they'll provide a list of numbers. They'll then match these to, or a communication provider will match this against their records and understand which specific users may need enhanced, I suppose, switchover package. And what that might look like is an engineer visit to ensure that they're successfully migrated and that their telecare continues to function following the switchover. But obviously then councils are having to balance that point around GDPR with the need to kind of protect these vulnerable residents. And it has been a challenge kind of pushing through that. But we're seeing a lot of movement now and positive engagement with communication providers, which is exactly what we want. Because ultimately everyone's just trying to protect those vulnerable people. There's also the point around the upgrading of telecare devices. So the majority of telecare in use was analog reliant. So that means that there has been this point around how do we procure then, I suppose, replacement equipment that is kind of digitally capable. A few years back, in many kind of digital solutions weren't necessarily available, so there has been that point. And then looking at different models of, I suppose, funding that activity also. Communications and scam activity. So communications essentially looking at should local authorities deliver local campaigns around the switchover? What's the correct messaging there? Obviously, it's about effectively communicating that the switchover is happening, but without worrying individuals overly. So there is that balancing act to carry out. And as a kind of addition to that, there is a potential for scam activity as a result of the switchover, and we have heard anecdotal reports of this in terms of individuals kind of utilizing the kind of increased, I suppose, conversation around the switchover to exploit vulnerable people around their kind of, their communication providers contracts, for example. Finally, we also have power outages. Previously, analog lines would continue to function in the event of a power outage, but broadband or fiber lines can't function as they can't carry a kind of current. So what that means is that communication providers have been exploring battery backups as a potential alternative solution to ensure that in the event of a power cut and an emergency, those vulnerable users can still kind of make an emergency call. And now we have a quick case study of Stockport Council and Stockport Homes working with VMO2 and TSA. Really is an example of, I think, switchover done well. So Care Call supports 4,800 people in the local area with Telecare. Stockport Homes essentially used a DSA to share telephone numbers of Care Call customers with VMO2. What that meant then was that VMO2 could look and check against their records, and they identified 191 vulnerable customers for enhanced switchover support. Now, what that enhanced switchover support meant was that a specific kind of engineer visit could go out and ensure that customers were successfully migrated and that their telecare continued to function throughout. And you have a couple of statistics on the left there in terms of high percentage of customers agreeing to the appointments, often it being next of kin or a support worker. And I think that's really important, is the role of that trusted individual in I suppose sometimes starting or encouraging those initial conversations around this. And I think the national campaign was mentioned earlier, the role there of be it the social worker, the OT, the support worker, care worker, in I suppose having that conversation, it could be really, really important. Yeah. So yeah, I now wanted to look at, I suppose, taking a slightly broader stance and looking at what an organization could do when it comes to the switchover. So in terms of existing services, we might look at risk mitigation, and this stream of work comprises the tasks that organizations should or could complete in the short term to understand and mitigate the impact of the digital shift on their existing analog telecare service and service users. That's not to say that it would perhaps follow this entire process, but there could be some helpful things to think about within this kind of process map. So I think first and foremost is that audit piece. So organizations need to have kind of accurate and current data on the scope of their existing services to allow the impact of the digital switchover to be established. For example, we might look at, who's using the service. And do we understand the kind of equipment that's in use, and is it reliant on kind of analog landlines? And as I understand it, I think Care England Fast Orbital Net to provide free internet and telephone audits for the care sector. I think that was as of October 2024. We then might look at the impact and timescales. So what will the impact of the switchover be on the kind of existing telecare service and technology? Understanding when your given communication provider will be carrying out that, their migration and working together with them on that date. And understanding how your current equipment will work when connected to a digital landline. Will it be severely impacted? Is there a kind of happy medium that can be found, for example? Risk assessment. What is the risk to the kind of telecare users? Are they particularly vulnerable? Is their equipment unreliable? Are they at risk of imminent migration? All of these might kind of lead to a sort of acceleration of specific kind of support around the switchover. Communication, again, as mentioned earlier, are people aware of the switchover? Can we put messaging out to make them aware? What is the best approach to doing this? When and how should they contact their communication provider? Monitoring, so looking at the existing service trends in terms of reliability, can that strengthen the case for a need for change? And then also contingency, so putting arrangements in place to minimize the risk to those using telecare, passing on the relevant communications at the right time, understanding the potential impact of a power outage on digital telecare, for example. Sorry, next slide. Thank you. We also then can look at future services, so the potential of moving to digital telecare. And these tasks can help organizations to plan and complete their move to digital telecare services. So here we look at mobilization and who needs to kind of have a seat at the table. In like large organizations, this may be a kind of whole range of people, be it commissioners, IT, finance, etc. But it may also be the kind of communication provider, the telecare supplier, those themselves who are using telecare, who needs to be there to have those initial conversations. Planning, so who is your current telecare supplier? Can the existing technology be a like-for-like swap? Or does it need to go to a kind of new supplier? Does proof of equipment also need to be changed then as a result, and the costs and funding options that are a result of this? Procurement, so how do we commission a new service? Will a new contract be required? Implementation, the size of the change, is it a like-for-like shift? Again, as previously mentioned, this vastly changes the kind of ease of implementation. What is the different equipment that's available from suppliers? What's the best solution? And what does installation look like? And can individuals be prioritized based on risk? Operations, does the switch from analog to digital telecare require an extensive change to operational processes? Is there much more data or frequent alerts as a result? And do they require additional digital skills, for example? And finally, this transformation piece. So how can the move to digital and new digital technology be used to improve and transform services? And it's this point around proactive, predictive, and personalized services and better use of data. And I'm sure Richard will probably touch on some of these in his presentation later. I appreciate that was a lot of kind of food for thought. There's a next slide on resources in which this can be explored in a little bit more detail. I suppose that the overarching message would be that point around auditing. So what devices do you have that are relying on analog services? Contacting the device providers, contacting your communication providers also, and then you have a bit of more of a picture as to where you're at when it comes to the switchover. Yeah, so a big thank you from me. I hope that's helpful, and I'll have a look at the chat now in case there are any questions.
That's great. Thank you very much, Connor. And now we're moving on to Richard Keys from 2IC Care. And Richard, I think you're going to give us a perspective of actually the analog to digital switchover as an opportunity. So over to you, Richard.
Absolutely. Thanks, Bev. Yes, my name is Richard Keys. I'm CEO and founder of 2IC Care. My background is running large transformation programs, and that doesn't include just include the technology, but also the change that surrounds that technology. And as James alluded to, the key to this, and no other tech provider will ever say this to you, but it's not all about the tech. There's an awful lot more to it to go on this journey, and hopefully I'll explain some of those as we move forward. So if we could move to the next slide, please. Lovely. This is just a small snippet. Like a lot of people entering the sector, mine was due to personal experience, monitoring a mother in New Zealand. So if you want to do about remote monitoring, that's an awful long way, over 12,000 miles. And it was just desperately disappointing, the lack of information you could get. And I was almost totally reliant on some sort of digital interaction because of time differences and what have you. So that's my personal experience and why I've moved into care, and that's why we've come up with the solution we have. If we could move on one slide, please. Lovely, thank you. This everybody will know, I'm sure. There are 2 million Telecare hubs out there. Most of them are operating on analog networks. Some people have started that journey. Some people regret having started it. I was talking to some even this morning that they were very pleased that they started the journey a little late, because the sector is moving and maturing very, very quickly. Some of you have probably heard about the 2G and 3G networks are starting decommissioning, certainly 3G, and Virgin Media O2 have now started to decommission their 2G networks. So a lot of people have already invested a lot of money into tech-enabled care that use these. So unfortunately, they are going to have to move on. We live in a rapid moving world in the age of technology, that the care sector has fortunately been sort of protected from because of the very, very old technology that we've been using. We must remember we have got to leapfrog about 40 years. The technology of a button in a box and through analog lines was designed in the 1980s. So that's making no use of smartphones or anything like that, no use of the internet. So we've got to think quite differently. And I find it quite disappointing that we're seeing quite a few people asking the same questions that they would have asked for a button in a box, and they're putting those on tenders today. The questions should be completely different. The risks are different, as James alluded to. But the opportunities are absolutely huge. We don't see it as an analog to digital switch. We see it from a no information to an information switch. And that's the key thing. You can provide much, much better care for all of your cohort of patients and residents, etc., if you know more about them. That I think there'll be no debate about. Let me move on a slide, please. Lovely. This is what I was alluding to, a future-proof technology, or a like-for-like. And a lot of people are replacing their current systems with like-for-like solutions, i.e. a digital version of a button in a box. There's probably a little more risk than they had before because of the connectivity types are not as robust as an old analog line. And now they are often just replacing exactly and missing out on that massive opportunity of using data. Every other sector has, made this move many, many months, often years ago. You've only got to think of your local bank if you're fortunate enough to have one. Banks just do not need the same number of people working for them. So we need technology to help scale this huge number of people that are aging, etc., and the greater needs, comorbidities, around, just to name a few. So that the needs are just growing exponentially, but we need technology to work with that. You can make a seriously grave mistake by buying bad infrastructural technology up front. And if you liken it to building a house, if you build your foundations and you don't know how many floors you want to put on, you're going to find yourself very stuck, because you might only make the foundations a certain thickness, which means I can't go 2 or 3 floors up because my foundations are bad. Well, it's the same with buying tech-enabled technologies. If you buy a simple, which might seem nice and cheap today, but if you do the same in the housing analogy, then you would have to pull out all your house, knock the whole thing down, rebuild the foundations, and then start again. And nobody wants to do that. It's a very, very expensive option. So the benefits you see listed there, that we can move to proactive and preventative care, which I'm sure you've heard an awful lot about that. We'll talk a little bit about that in a second. We talk about the data is very interesting, but moving from data to information is quite a big step. Lots and lots of raw data is very difficult to analyze and what have you. So what we need is that to be filtered out of what's important and what's not. The care sector is unbelievably overworked, and I'm sure you'll agree that you just want to know the facts at the right time. So that's what that's about. So the moral of this page is really, please make sure you're looking towards the future as much as you possibly can. And I do realise budgets. So can we move to the next slide, please? A tech-first approach. A huge number of councils are going down that route. There are really huge difficulties in hiring people, finding people, keeping people. So technology is going to provide that scalability and that consistency that we all need. We all need consistency of care as well as high quality care, and that technology of monitoring and giving you the information. So many councils have and organisations have sort of put tech-enabled care to a side from mainstream care. And I was really pleased to see in the last few days at iTech conference that there's far more talk about technology should be part of normal care. It's not something, an adjunct on the side. It's really fundamental to where care should be. So please keep that in mind. The next slide, please. This is a picture of our Andy hub. What's slightly different about it, and I think this is part of that foundations that you need to buy. You want to think, do I need classic reactive care? Do I need connectivity through to a call center and a two-way speech? That's probably correct, like most of them are. But those same people might also need proactive and preventative monitoring about their gait, about their diabetes, about lots of things. And to have a hub that can cover all of those is really vital. We also feel that telehealth is just on a spectrum along with care. So the idea that I must admit, we get a bit fed up with going to health conferences and finding none of the care providers are there, and vice versa. It is so important that we're working with health quite closely, because the care needs are just a continuum from a virtual ward to reablement to normal care, whether you're in a care home or in your own home. So that's where part of that foundation work again is try and get something that is forward-looking. We know people's well-being needs move up and down, for that matter, and you need a solution that'll move up and down with it. So often we've just had, whether you had diabetes or dementia, somebody said just put a button around someone's neck, and this new world, this new paradigm totally discredits that, and we can move on to something new. Lovely. The next slide, please. Lovely. Dashboards, really important. There are a lot of discussions at the ITEC conference, or a lot of these conversations, very reminiscent of the ones we've just had in the last few days. A lot of people now are saying there are fantastic solutions out there, whether they be health solutions or care solutions, but a lot of them are siloed. I always ask everybody, if you can go to your tech provider and say, what if one of my people had diabetes? What would you do for me? And if the answer's, I don't know, or nothing, then you've probably moved the wrong way. It's so important because people's needs change. So you need one place, one holistic view of that data and the dashboards. So that's what we're trying to provide with Andy. A single view. Nobody wants to log on to half a dozen systems, one for their movement and one for their sleeping, waking nights, etc. You need one place to look, and it's got to be very, very simple. So it's about getting these actionable insights. We talked before about data, moving data to information, and then the next stage is information moving to actionable insights so that you can get on top of things immediately. We don't have time to look at pie charts or line charts. We got asked literally yesterday about that. Can I have a trend chart that shows arrows indicating where things aren't going very well? And I said, well, you've got 2,000 users. Are you going to go on every day and look for a chart so that it'll tell you that? What you want is something to tell you the exceptions, where things aren't going well, not to look at lovely charts. They might look good, but that's the last thing that people need. They're too busy. So if we can move on to the next slide, please. At the heart of it, it's all about improving outcomes. We need to save money. We need scalable solutions, but outcomes are absolutely vital. And, creating greater independence, more choice of devices. So many people have comorbidities. To have somebody who's got cardiac issues and you're not monitoring their diabetes at the same time is a massive problem. You can make grave mistakes if you don't know the full picture. False alarms is really vital. There are so many false alarms out there in the market at the moment, and having solutions that can help reduce those is vital. We've talked about preventative care, personalization, we've talked about as well, and staying connected, that resilience, getting the message through. There's no point having the best system in the world if the message isn't getting through to the carer that needs it. So, and I think that's the last one, the last takeaways. I'd say, please evaluate or reevaluate your approach to technology and care. Make sure it's embedded in the care process. It isn't an adjunct. It isn't just something on the side that you go, well, I don't have the ability to help these people, therefore I'll throw a button at them. It's not good. One of my favorite terms is reckless conservatism. Most people don't like change. And this sector is absolutely vital that we make this change and do the right thing now, because we won't get the same opportunity again. This A to D move is the impetus to make us go and do, move to this data. I'm sure none of you would suggest not knowing much about the people that you're caring for is a good way of going forward. You can only help them better and more timely if you have the right information at the right time. And please feel free to come and talk. We are not going to just throw pieces of plastic at you. It's not what we do. We love to discuss tech-enabled care strategies, and it was great at ITEC. I've been there for 4 years now. I think year one, people were talking about pure A to D. The year two, they were saying, well, what's proactive, preventative, and how does that work? Last year was all about return on investment. How do I make the savings? And I'm really pleased to say that this year, a lot of conversations we had were about how to get adoption, which was a great conversation. So thanks very much, Bev. I think that's just about my lot. So I will pass back.
That's
Thank
great.
you.
Thank you very, very much, Richard. So thank you to all of our three speakers. That's great. I think we've had a great overview from those three speakers. Just checking Eleanor to see if we've got any questions. I know there was one around finance. Emily, you gave a very comprehensive answer in the chat. I'm just wondering if you could come in and maybe do a shorter version of your. So the question was whether there was any funding available to support the analog to digital switchover.
Hi, yeah, so basically the short answer is for future funding, we don't actually have a robust evidence base at the moment, because a lot of the providers have been able to do it within their existing funding. But if anyone has any examples of evidence that they could send to us, then that would be really useful, and we can help build that evidence base. So yeah, thank you.
Brilliant. Then Eleanor, I'm not sure I can see any other questions in there. I've got a couple of questions though, so some common questions when I'm in other forums that come up. So I hope that's not too cheeky to my to the speakers this afternoon. So Emily, it's really great to hear that you're interested in how adult social care providers can be pulled into the work that you're doing at the department around the switchover. So that's fantastic. And we certainly hear, so I know for home care providers, they're often quite perplexed about their role in the analog to digital switchover. So they will be providing services to people who are also telecare service users, and what their responsibility is. So, you know, the advice at the moment, we're saying, you need to look at your responsibility with that person. Is your main communication method with that customer a telephone line, which it often is for a lot of people? It will often be a telephone call from the home care provider to say whether there's been a change in your carer or your carer's running late. So we're talking about that. But yeah, I think there's a real opportunity for adult social care providers to get more involved, because often they're dealing with the same people, aren't they, that are telecare users. Yes, so I was going to turn that into a question. I haven't turned it into a question. But what I would do is encourage people to respond to Emily, and if you can put in the chat and follow through and say how you would like to get involved, I think that's really important. Connor?
So I was just going to say, at least from my perspective, I think that the potential role for home care providers, especially when it comes to the upcoming national Telecare campaign, could be huge. A huge element of that will be this kind of self-identification piece, which is, you know, the person using Telecare to call up their communication provider and register themselves as being,
get identified.
Identified, yeah. And I think, yeah, important not to underestimate the importance of those trusted individuals in having those conversations, be it a family member or be it those who are on the call who can offer that. So, yeah.
Yeah, brilliant. That's really helpful. And I think, Connor, as well, just for care providers, I think it's over 600 different communication providers. So obviously our many care providers could have a relationship currently with one of those 600 communication providers. So I would also encourage you to be speaking early. If you haven't been part of the switchover yet, speak early to your communication provider. You need to understand that they know what's happening around the analog to digital. And coming back to Richard's piece, it could be an opportunity for you to upgrade or change your communication provider based on those initial discussions, I would suggest.
Absolutely. Yep.
Yeah.
Yep. 100%.
And Richard, just a reflection on the information that you've given us. So I think my takeaway is be ambitious, and like for like. If you're doing like for like, that's a mistake. So I think that's a really strong message, because there absolutely is an opportunity here. And you and I both talk about leapfrogging often when we see each other, don't we? It's just like, you know, we've got to be at the cutting edge of tech for it to be fit for purpose from the day it's implemented going forward. And you talked about getting that foundation right. So I think that's also really important, isn't it?
I'm sorry, Bev, I'm just looking at Deborah's chat about the dual SIM. We were talking about leapfrogging and dual SIMs and single points of failure. I just thought I'd chip in on that.
Oh yeah, thank you. Yeah.
If your local mobile master's down, you could have 38 SIMs. It won't make any difference, I'm afraid. What's vital is you have two different routes back to in terms of telecoms, back. So you want to use a SIM and a landline, for instance. If you really want dual ways of going back. So I think that goes back to your telco provider. It's certainly not a lot safer to have two SIMs than one. That's for sure. Hopefully that makes sense.
Thank you for responding to that. Katie, would you like to come in?
Yes, I just wanted to check, Bev, if you'd seen a question from Emily Davison in the chat, which is they're looking to spread awareness and information to our care homes and home care providers and older persons commissioning, and whether there's a standardized methodology to share information and what simple language can be used. For example, is simple actions like make sure you have a wide internet connection in the residential space or anything similar that the panel can signpost to.
The Emily from DHSE did start to answer that, but I don't know if you wanted to elaborate, Emily, on that one. Oh, Emily, it's confusing.
No, yeah. So those links that I just popped in the chat will probably be the best sources. And there's also Age UK and a lot of charities as well, which have some really good information on there as well. So yeah, I would just visit all of those websites.
Okay, that's great. And I just wondering if we've got any other, I'm just checking if we've got any other questions. No, I think, oh, Connor, yes.
I was just briefly going to add that we also have some kind of communication
Resources.
materials that could be used as well. So I'll pop them in the chat also.
Yeah, that's really helpful. Thank you very much. Great. Okay, if there's no more questions then, I think we can conclude. Huge thanks again to our three speakers this afternoon. With those three different perspectives, I think has been really helpful. I would encourage attendees to keep an eye out, sign up for the Digital Care Hub newsletters, keep an eye out on their resources. Their resources are increasing on a daily basis. There will be other opportunities, other webinars on the analog to digital, and just get in touch really. And encourage you as well to think about Emily's offer. I think that's a great offer from the department to get adult social care providers more broadly involved in the analog to digital switchover. And I think on that, we can give you some time back this afternoon, which is, I think, always appreciated. Thank you for joining us. We will be sending, to a reminder, the slides are coming out to you and a link to the recording of the session. So thank you very much and enjoy the rest of your day.
Thanks, Bev.
Thanks all, bye.